Hello friends, welcome to my channel. I am Dr. Himanshu Gupta and today I have with me Dr. Abhishek Jayant sir, who is doing SRship in Maulana Azad Medical College, and he will be discussing with us pros and cons of radiology as a branch and why should you choose radiology as your branch. So welcome to the channel sir.
Thank you for giving me this opportunity.
So sir, first I want to ask you, why should toppers choose radiology as a branch sir?
Toppers, well, we need toppers here because it is a very challenging branch. And if you want to see a new challenging case every day, if you want to solve a mystery every day, you should choose radiology because it is a very interesting branch. And every day you will see a whole lot of spectrum of cases. Like the first case we will be seeing of a vasculitis, a person who has not, he's having fever since many years, but it's not been diagnosed. And then you do a CT and you see changes of vasculitis. Then you see a patient who has swelling in his arm or leg, and that's a case of osteosarcoma. The other case you see the GB carcinoma, uterine perforation. If you see a big spectrum of cases, so it's very interesting, very challenging, and we expect toppers to do that because they are the most intelligent of the lot.
So people should choose radiology because it has a very cool life, or because we can see a wide spectrum of cases in this?
It depends on you. What do you want? The thing with radiology is that you have choice. If you want to have a cool life and earn money, then you can join a private center. You work there from 9 to 4. You'll get a good amount of money, and there won't be so much pressure on you. You'll work from 9 to 4. You'll have a lunch break, and you can enjoy life. But again, if you want to, go for
clinical.
If you want to go for clinic, if you want to know what you have diagnosed is actually there or not, so you should then join a big center where they have histopath reports, where clinicians come for follow-up. That way you can, you will know that how you have affected the patient's management, and you can, if you want to go for an academic, if you want to do well academically, or if you want to teach people, then you can go for medical college consultancy also. It depends on you. And even if people say that whether there is patient interaction or not, it again depends on you. What do you want? If you want to have good patient interaction, then you can choose intervention radiology. There you will be directly involved in the management of patient.
If a student has inclination towards a clinical branch, then he should choose radiology or not? Like, if many students are confused whether we should choose medicine or whether we should choose radiology. Like you are saying that we can go for, if we have some clinical inclination, we can go for DM courses. But would it be a better choice to go for medicine or radiology?
It depends on the person. It totally depends on the person.
Okay.
Whether if he has made up his mind that he wants to do medicine, then of course he should do medicine.
Okay.
But as far as this thing is concerned, whether there is any clinical or patient interaction or not, that is what I'm saying. You have a choice here.
Okay.
If you don't want to have patient interaction, then you can simply do CT, MR and ultrasound. Don't go for intervention. Even in ultrasound, you'll get patient interaction. When you ask the patient what are your complaints, where you are having pain. While you're doing ultrasound, you correlate with what patient is seeing and what you're seeing on the ultrasound screen. So you can have that. If you don't want, you can do only CT and MR. You won't have much patient interaction. But if you want to have patient interaction, you can go for intervention radiology. If a patient who has a severe GI bleeding, sudden severe GI bleeding, the clinician will call you. You will be the person who will come and rescue the patient, who will embolize the artery, whichever artery is the culprit, and you will save the patient. So it depends which way you want to go. So the radiology gives you the choice.
Okay, so we have the benefit of going into clinical as well or going into non-clinical as well. Many people say that radiology gets boring. We have to sit in front of the screen throughout the day. We are just seeing images. So what do you want to say about that?
I've been practicing radiology. I've been learning radiology since last 4 years. It never gets boring. According to me, every day you see a new case, every day you see something different. Every anatomy, every physiology there is in the body, there's a disease and there's a radiological spectrum. Moreover, this is a very new branch. Every day something new, some new research is coming, some new criteria is coming. The other day I was reading that just by looking at the interventricular septum, on NCCT you can decide whether the patient has anemia or not. So every day a new thing is coming, a new research is coming. It is a new branch. I think something exciting is coming. Even as in the routine practice, the clinicians or will come to you, they'll ask you, what do you think? So you have to look at the scan and you have to decide. You have to put the patient's clinical demographic data and the scan, whatever you have seen in the scan. You have to put it all together, and then you have to make a diagnosis. You have to tell the clinician, okay, I think this is what it is. And depending on that, the clinician will treat the patient. Patient's treatment, the main part is diagnosing. For treatment, there's a set of protocols that is fixed. These many tablets, these many mgs for these many days. The main thing is diagnosing, and you are making you are playing a very important role in diagnosing. so it never gets boring.
We are making a diagnosis without doing any intervention.
And in fact, if intervention plays an important role also. Sometimes you feel whether it is malignancy or infective, you can go ahead and do a biopsy. You make a biopsy from that lesion, you give the sample to the pathologist, whatever the result will come, then you can give a final diagnosis. Okay, this is malignancy, you have to treat it like this.
Sir, can you mention some instances that have made the radiology very attractive for you, that have fascinated you?
No, there is no such single instance I would like to name, but every day when I come to every day I'm coming to the hospital, I'm excited about it. Okay, today I'll see something new. Okay, if I am not seeing something new, I'll ask somebody, okay, what are the good cases that you've seen? Every day you see a different spectrum of cases. Every day you see, okay, so this patient had this, and biopsy was done and this came. So every day you are learning new things. You are seeing new cases. You are seeing different spectrums from orthopedics to gynecology to pediatrics to neurology. Everything you are seeing. So it's exciting.
Many students also ask this, like if they have got a seat in their state college. Okay. And when they get a radiology seat in the state college, they are also eligible for DNB in Delhi.
It depends on the college, and it also depends on some other things like whether there's a bond or not. Being DNB, there's no bond. So I'll tell you, like if you have to go to the college. If whatever college from the rank, you must be kind of guessing what college you'll be getting. You should go to that college. You should ask your seniors which all modalities are there, how much work you are getting, how good is the level of reporting, because it's not that whatever we report is actually what it is. So in DNBs or in big centers, the good thing is that you'll get a follow-up either from the clinician or from the pathology that what you have reported and what actually it was. That is very important part of the radiology, because you can write anything, it doesn't matter, but actually what it was, you can only get from the pathology or from the follow-up of the patient actually. So if you have if there is a hospital in MD where you have a good lots of patients, and you're getting good lots of patients in all modalities. You are getting good numbers of X-rays, CTs, MRIs, interventions, in non-vascular interventions, and fluoroscopy, everything you are getting, then go for it. If you're not getting, and if you're getting a college in DNB where you are getting all these things, then you can opt for that. Right now, I don't think there's a big difference between it's all in the mind. It's all in the mind. After doing MD or DNB, you can either go for private practice or you can go for SRship. In Delhi, because I can only tell you about Delhi because I'm working here. In Delhi, there's no such thing that he's from MD or he's from he has done DNB, so we should take him or take her or not. It depends how much for AIIMS, there is an exam. If you clear that exam, theory exam, if you answer the questions in paper, you'll get through. Even in MAMS is the same thing. They'll ask you questions in an interview. If you have done presentations and poster presentations and publications, and you would answer all the questions correctly, everybody judges you by your knowledge.
So in radiology, it basically depends on the knowledge.
It depends on the knowledge.
It does not matter that whether you have a DNB degree or an MD degree.
But what I would like to say is that if you have done DNB from a private college, then you should do SRC from a government college. If you have done from a PG from a government college, it can be you can do SRC from a private college, because you should get you should see how things are done in both areas. So because everywhere some people are doing something differently.
So at last, you have done your DNB from Gangaram Hospital. So can you tell us about the environment that is there in Gangaram?
Okay, so since I have done from Gangaram, I have done my DNB from Gangaram, I can vouch for that. It is a very good institute for radiology. The consultants are really good. You get exposure to all the modalities: X-ray, fluoro, CT, MR, intervention. You get a good exposure to intervention also. Then ANC cases. And everywhere you are free to report cases. Nobody stops you. You have good consultants, very helpful consultants who will be guiding you, who will be correcting you when you are wrong. Then you have PACS or an hospital information system where you can see last 2-3 years, 4 years cases with reports, with post-operative intra-op and post-op findings, which will definitely help you to become a better radiologist. So these all things are great there. Of course, passing DNB is a difficult thing, but that also is a blessing in disguise, because since you have to pass DNB, it's difficult to pass DNB. You'll be working hard for that. In that course, you'll be reading much. And for that, even in practicals, you will be running here and there for classes, for presenting cases. So you will be seeing museums of different hospitals while preparing. So all in all, you will see a good spectrum of cases just because you are afraid what will happen in the exam. So that is good. That is not bad in my point of view. And in fact, the percentages are improving. In fact, in my center, on my day, all 7 of 7 passed.
Okay.
So
there is no scare of failing.
It depends on you. If you are working hard, of course there is a 1% luck factor, but 99% depends on you. So if you are working hard, you have seen a good spectrum of cases, you know the basics, mostly you will pass.
Okay. Sir, at last, what message you want to give to the future radiologists of India so they can be very good in their field?
I am no one to give a message. I can just advise them. Radiology is a very good branch. It's a very fascinating one, but you have to read very much. It is one of the branches where you can challenge anyone with your knowledge, because everything has now every diagnosis or everything has a set criteria. If you know the criteria, you can make the diagnosis. So you have to read. You have to keep reading. You have to keep updating yourself. So if you get into radiology, start the habit of reading as much as possible. Whenever you see cases, you read about it. Keep yourself updated.
We have to start from the first year.
Yeah, of course you have to start. You don't have to finish everything first year, but definitely start with the first year. Start with the X-ray fluoro. Then it is a lifelong learning process. Everybody is learning.